Perfect. Excellent. I would love to welcome all of you today to our Careers in Technology Spring Series. And this is a special event with Dr. Paula Muller, who's an entrepreneur. Her company is called CareLink 360, helping aging adults connect and engage with their loved ones far, near, simply, and globally, while providing peace of mind to those who care for them. Dr. Paula Muller, Biomedical Engineer, will describe her professional journey and take a deep dive into the high-tech world of an entrepreneur bridging the generations. Dr. Muller is an entrepreneur at the forefront of technology with innovative intergenerational communication platforms, with extensive experience in scientific research and product development in the areas of signal processing for medical applications and for audio coding, as well as with data security, web applications, and telehealth products and services. Okay, I'm going to stop sharing now because Paula we just want to have a conversation with Paula tonight. Right, Paula?
Yes, absolutely. Thank you so much, Kit, for inviting me. Wow, you were saying the project, we had 8 years and we know each other and we have been working for quite some time, at least 10 or 12 years, which has been great, a great collaboration with Kit, and I'm enormously grateful for all her contribution to our progress, and in particularly the patents that we had. Kid made them possible. So thank you so very much, Kid.
Oh, it's so funny. I love hearing from you because I get to catch up on things and reminisce as well. And so what maybe people here are unaware of is when Paul and I first met, we discovered we had so much in common. And Paula really taught me so much about being a volunteer with IEEE that it's just an unbelievable amount of knowledge I learned from Paula. And then there was this opportunity that she had where she had her company and she had reached a point where she just had to decide whether she was going to continue with her patent or not to finish the pilot. And it seemed to be somewhat expensive to continue, but we decided to take it on as a volunteer project. And we worked together and did a lot of writing, and it was, quite a thing. Very ambitious, right?
Yes.
And
And
it
we
actually,
got two, and we got
yes,
very
and
quickly, and
it
very quickly.
worked. It worked. And I don't know, I remember some of those interesting conversations. Well, we want it to be this way. Well, maybe we want it to be this way. Well, and it's not my patent, it's her patent, right? But I think when you're working with somebody, just having those conversations helps people see a bigger picture, right?
Mm.
Can you describe that maybe a little bit?
Yeah, absolutely, because I was very focused on the product, right? What we have developed, and what we were going to, but very specific. I'm very focused on what is realistic, what I know it can be done, and how the things can be changed in order to accommodate things. But then Kit comes with a three, I mean the tall building overview, and then she starts saying, but you have to think about the future, what new technologies may come into the future, and then you don't want to restrict yourself to what you're doing today. And that was the whole new perspective. And it came out great, because it's true, we're not doing everything that we're doing, but we're set up and protected to embrace all the things that make sense to incorporate into the product. So yeah, and that's really the purpose of writing a patent, that you are protecting your current invention, how you have deployed and implemented, but then also what you foresee would make sense to incorporate, and based on what you know the future will be, but also what it may come, but all based, I mean, we're not speculating in this. This is also the other balance, right? That you're not creating sort of a rabbit out of the hat, making magic
Yeah.
things that are not possible. I mean, all the things that we added are feasible, and it's just a matter of having the funds to be able to incorporate that technology.
And then we had an office action right away. And it was really quite interesting because the agent in Washington cited people that I actually knew and worked with at Bell Labs. And I knew the work that wasn't Paula's work. It wasn't anything close to what Paula was doing. So I was able to like actually speak to the office agent during the office action, right? And this was very exciting for me. I don't know about you.
No, and it was, I think, having that knowledge and that background from Bell Labs and all the connection that we have through IEEE was very valuable because that gave us credibility with the agent that was reviewing our patent. And he was extremely receptive to all what we were telling her. And I believe that was part of how our patents got approved so in remarkable, based on what I know from other comments. I mean, in remarkable, a quick time, and during COVID too. Yeah.
Yes, there was so much uncertainty, and there were a lot of people leaning into new technologies at the time. There were a lot of new changes going on at the patent office.
Mm.
But now we're going to go back to the very beginning, and Paul's going to tell us about her childhood, where she grew up, and how she decided to come into this technology domain.
Oh, thank you, Kate. Well, it's a long time ago. Oh my goodness. Well, I grew up in Chile. That's my accent. I was and I spent all my childhood and teenager years, and even my bachelor and master degree, all were done in Chile. I study electrical engineering, but I went the route of electrical engineering really because my main motivation was biomedical engineering. From very early on, I wanted to apply. It fascinated me the capabilities of applying technology in the medical field. And at that time, it was all about, we're talking about right now, biomedical engineering is very wide, and you have I mean, you have tissue engineering, you have prosthetic, you have, you name it. But at that time was really all about signal processing. How can we understand electromagnetic signals from the brain? How we can understand images? I mean, X-ray, CTs, PET. That was the main domain, signal analysis at that point. So that was my area of basically going electrical engineering to be able to go into the field of biomedical engineering. And then I was very fortunate that I got a scholarship to go to Switzerland. That's the Swiss here,
The
the
Swiss
story,
connection.
the Swiss connection, right? So I spent 2 years at ETH, the
Me
um,
too. I did the same thing. I did 2 years at
yeah, so
ET.
that's what we have, so many
Yes,
things
yes,
in common. Also in Zurich.
right. Mhm.
And and then I even was able to start my PhD in signal processing in ETH. But as sometime life have changes, I met my husband at that time. We were not married, but we were much decided that we wanted to spend the rest of our life together. And he got a job at Bell Labs here in New Jersey. And that's how we ended up in New Jersey, because he took the job at Bell Labs. And it was a very interesting group. He actually joined the group that was doing all the initial work in artificial intelligence with the digit recognitions. And basically, they put together this marvelous system that was reading digit of checks. I think they had an EC machine that it was using their technology, and so he joined that group. And then he spent, and he still is working in artificial intelligence today. So he being at Bell Labs, I was fortunate to join Rutgers University, the PhD program in biomedical engineering. And my story there is, it was quite interesting. It was the very beginning of functional magnetic resonance imaging, fMRI. And nobody was doing experiments like that in Rutgers at that time. I'm talking about uh, late 1990s. And so my job was to figure out what type of experiments we're going to do, what are the protocols, how to set up the machine, run the machine, have the images, how you're going to do the analysis, and get results that basically mean something. Our focus in the lab where I was working was in eye movements, to identify which portion of the brain are reacting to different type of eye movements, and also visual processing. So how the brain react in front of different visual patterns, and we also apply fMRI at that time to Parkinson patients, how their brain changed when Parkinson patients, the one that qualify, can go through thaladotomies. So it was quite an interesting time. A lot of late experiments because I was only able to use the MRI machine after they had their regular examination, which at that time were running very late. So I always was able to start my experiment at midnight and run them until 3 or 4 o'clock at night. But
I had the same experience. I did fMRI. It's really strange. We've had almost parallel lives. I did fMRI at NJIT and UMDNJ. And it was also visual, but I was doing virtual reality and I would taught people sign language. And we looked to see like if you moved your right hand and we showed you your left hand moving, this rubber hand experiment thing that you've seen where people do the mirror image of things.
Mhm.
What part of we were able to relateralize activation into the area of the brain where people had a stroke, where they couldn't voluntarily move their hand, but they thought they were moving their hand because they saw it. They engaged and then they saw it, and then it was brand new stuff at the time. So this is like this is my sister, my twin sister here, doing the same stuff at the same time, only we hadn't met. We didn't know each other. And
At
then
that
eventually,
time, no,
just
we did
yeah,
not.
the IEEE brought us together, which is really, really great.
That's
And
true. That's true.
yeah, yeah.
That's true. That's
So then
amazing.
you moved in at some point you decided to you were working with Sirius Radio as well, right? You did some.
Yeah, that was a fun work because and the real fun of that was, well, the project was interesting on its own. I mean, I was part of the group that was doing all the audio compression. So we were, and the constraint at that point, I imagine, are different today. We had a satellite that was not too many. I think they have one or two for the company, and you had very restricted bandwidth, and you wanted to climb as many channels as you can in that limited bandwidth. So the magic there was, how can we manipulate as many bits as we can and keep and preserve the best that we can the audio, taking every advantage and misusing the capabilities of the human ear. So probably the dogs would have been hearing very cringy music, but we were able to manage that the humans were accepting it, and that was my job to fine tune, especially the channels that got the lowest bandwidth. So I was coming home every night and basically singing to my husband what I was hearing all day long, trying to get the best audio compression out of those pieces of music.
So
So
so one
listen
of
a
the
lot of
things that we've been thinking about recently is this like how audio compression affects people whose voice is in a different frequency, like the fundamentals, the harmonics, and the overtones, and whether or not it actually plays well, when you're listening to something that's using VoIP kinds of
oh
technology.
yeah. Yeah, I mean,
And
I mean, and the technology has evolved quite a bit, very, very interesting, and also the capabilities. To be honest, I don't know right now how Sirius and XM are sharing. Probably they are taking advantage of all bandwidth that they were able to collect simultaneously. And even they are taking advantage, if I understand that correctly, at home or in the car, if you have some Wi-Fi or basically some wireless, if you have access to some wireless data, you will have access to additional channels that they are only transmitting through the internet and not through the satellites. But also the audio compression has evolved quite a bit, and the advantages that they can, the technology that they can use. And I assume also changes in the microprocessor, and all what you can do on the studios, also the processor that you are managing on the studios. I was involved on both sides. But audio, I mean, is fascinating. And one area that I find it fascinating that it applies to what we are doing right now is how audio and voice and all the markers, let's say biomarkers that you can identify from voice, in terms of what you were saying, Kit, the tone, the melody, the frequencies. I mean, you can have so many characteristics out of the audio and even the linguistic patterns, right? So
Right.
what languages, uh, how, the syntax that a person use, the stuttering, the vocabulary that they use, all of that give us a wealth of information to identify diseases. I mean, we're identifying depression, anxiety, even mild cognitive impairment and Alzheimer's and dementia. I mean, there are some studies, a lot of people are working in voice biomarker to be able to identify, and even, and you don't need to do a language analysis per se. You just can, by those other signature, identify a lot of information, and even not even identify the speaker in a large environment. Just by picking up the margins, you can identify, let's say, in a subway, if there is a person that is agitated, and it can be dangerous. So it's
Right.
going into those directions, which is fascinating.
Yeah, I mean, back in the Bell Labs days, we had done some work with Doppler microwave to do heart rate, heart rate checking, measuring the heart, doing respiration, and non-contact. It's orthogonal to ultrasound, so it's totally passive, and you can get the signature of the person and get some very good information about whether they're nervous, are they carrying a bomb,
No,
whatever.
no, but you are right. I mean, just I mean, the voice and audio signals are fascinated. They are even looking into diseases, respiratory diseases,
Right.
but even heart rate and others that you can identify by picking up some markers of how that person is speaking or breathing as they speak, and that can tell you some valuable. I mean, really, they are using voice biomarker in a lot of fields, and the beauty of that is that it's a non-intrusive and basically, in real time. You don't have to take a blood sample and send it to the lab and do an analysis or an fMRI, or I mean, it's that simple, non-invasive, and everyone can do it.
And you can even come to understand like when people are having a good time of the day versus a time that is more challenging for them. So you could proactively find some therapy or assistance that can help a person when they're getting older, for example, or if they
Yeah,
have a challenging situation, like what time of the day do you perform best on your job? I'd really love to plan the more complicated things around the times I'm feeling better or more alert. And I'd like to have a system that can help me understand my own peculiarities so I can select, schedule
absolutely,
things. But I imagine
absolutely.
that sort of thing must help you a lot to get insight into the people that you're helping who are aging with the
Yeah,
systems that you design. Can you
yeah,
help us
yeah,
understand something about your systems and how they,
yeah.
yeah,
So the situation after working in the industry. I'm being very blessed that always the solutions that I was working on had a direct impact on a product that was being used. I mean, SiriusXM was great because I was able to point the radio from my neighbor's car and said, I work on that. And that was quite nice to say. As engineers, we not only can relate to our neighbors with what we do, but that was a great opportunity. But then
Internet is,
working on
as it is
uh,
not
hos-
bandwidth,
hospital discharge system.
internet is not bandwidth constrained.
No,
Sorry.
no, that's perfect. So after um, working in the industry for many years in very interesting solutions, I decided I wanted to do something for myself, and that's when I started my company almost 10 years ago. And the motivation was, how do we bridge this technology gap between older adults and the rest of us? I mean, we are all connected using a smartphone, computers, but I saw very prevalent there, and it's still the case for many older adults. It had shifted, but especially because of the pandemic, but still there are so many older adults for whom mainstream technology is just too cumbersome to use, either because they have cognitive impairments or just because the devices are not suited for them. If you're thinking about arthritis or even sometimes the conduction of your skin is not the same when you are a younger person as when you are old. Therefore, the responsiveness of our touch screen is not the same. So bridging
Does
that.
everybody know that? I mean, like, this is something that like biomedical engineers kind of know about, but I'm wondering if this is general knowledge. Do people understand that when you touch your touch screen as you get older and your skin is drier or whatever the properties are, that your touch screen just doesn't work properly anymore, or the way it was calibrated for younger people? And then like, how do you deal with that? So, Paula, how did your company
So
solve?
what we decided to do is really to focus on simplicity more than a lot of futures, just simplicity to just get to the point to what it matters the most. So for us, what it matters the most is connectivity and engagement. We are very focused on trying to solve the prevalent and pervasive issue of loneliness and isolation among older adults. Because as a result of not using these smart devices, they are getting lonely and isolated. They are second recipients of information, if at all. So if something happened in the family, everyone is texting each other or using any other means, and then if someone is kind enough to tell them what is going on in the family, they will know, but otherwise they wouldn't know. So how do we empower them and give them that direct access to that technology in a way that is not intrusive, is not frustrating, is secure? That is very important because unfortunately, our older adults uh, are really the victims of scams, of predators, and we don't want that. And they are scared. I mean, every time that I meet older adults in presentation, that's the first thing that they say, I'm just sick and tired. And they are putting barriers. They are getting even more isolated because they're putting barriers on their phone system that uh, they don't get all the phone calls are screened because they don't want to receive a call from someone that is going to ask them for something, and yeah, it's terrible how people take advantage of older person and people with disabilities. So
But
that is our yes.
Paula, there is a question in the chat
Yes, thank
from
you.
several minutes ago. The question is, have there been any voice profiles with regards to Parkinson's?
Yes, that is, thank you for that question. And yes, there is research about trying to identify um, Parkinson disease and how it evolves So yes, thank you very much for the question. Research is working in that area.
So I just wanted to pull up your website to give people an idea how they can find you and
Thank you,
learn more
Kit.
about.
And if you find if you look at if you scroll a little bit
Mhm.
down, I can tell you what were the areas that I focus with developing this product. So I decided, okay, so how can we bridge this gap, right? I'm from the very beginning, I realized this is not another app that they are going to use because the app ecosystem is cumbersome for them to begin with, and many older adults didn't grow up with the concept. So just learning that these apps can do so many and how do you access them and how do you use it in order that they can be useful for you is just too cumbersome for them. And I'm talking, and please be mindful that the population that I'm focused on serving are, are not on a specific age, but on a specific group of persons for whom right now mainstream technology is too cumbersome and even more so is frustrating, and it causes them anxiety and even depression because they feel that they cannot do anything with that, they think that sometimes even affect the way that they perceive the value that they have, which is ridiculous, right? So my
I
focus
mean,
was
it's kind of like you're asking every person to be their own IT consultant in their home. They have to understand the connectivity and the equipment and how to, deal with every vendor that they have, their internet provider and all these other people that, that maybe this isn't working because of this thing or it's not working because of that thing. And you managed to bridge all of that in your
correct.
product. Yeah.
Thank you, Kit, for mentioning that. Yes, so this is not an app, this is a turnkey solution. Our company is not a hardware manufacturer, but we do specify and we do manufacture this device to our specification. And we are a software company in that regard, but our application is the only application that runs in this device, and the device is really a turnkey. So it's self-contained. It doesn't have a web browser or no other application is dedicated to do what we incorporate in that design, in that feature. So there's no web browser, no email. They cannot go to the internet and buy something in Amazon or go to Facebook or get an email and get a spam. Nothing of that. It's a self-contained dedicated application, and the objective is really to provide communication, so video chat, sharing pictures with the family, sharing videos with the family, and then through the years, we incorporated a series of activities. We have over 400 activities that they can do in this touch screen, and we are also a distribution channel for multiple content. It could be educational content, entertaining content, and everything targeted and curated for older adults that satisfy their interest and need, and the level of uh, being simple enough and
And I,
sophisticated
I
also enough for
understand,
them.
I understand that someone can help the person from the remote, like a family member can activate these features too from.
Yes, so since much of my focus is to serve also the population, older adults that are living either with mild cognitive impairment or early or mid or even later stages of dementia, we have incorporated a lot of automation, and automation in the way that families from their companion app, that the app that they install in their smartphone, can initiate remotely a play of a video or schedule the play of a video. So then the older adult, so just a simple example, think about that dad enjoys, uh, let's say, Mozart in the morning, but now is even following three buttons, a sequence of three steps may be cumbersome for him. So you just can schedule from your companion app that dad is going to listen the music that he loves in the morning to have a very uplifting waking up in the morning.
I love that. I love that.
That's
I find, music is such a great way to start the day, right?
Thank you.
yeah,
I think there
music's
was
divine.
some comment.
Oh, sorry. I didn't.
Paula,
Sometimes I
just
don't hear right away. There's like a delay from when people begin to speak, so I apologize for stepping on you. Yeah. So, and not only that, but there's like active body, there's spirituality, the sing
Yeah,
along,
we're
mind.
very, thank you, Kit, for
Sure.
mentioning that because we're very focused on customization. So this is just a sample of what we
Mhm.
can incorporate, but really we ask our families, what are the things that your mom or your dad like, or your aunt or your grandma, and that's the type of content that we incorporate. And we have partnered with beautiful and wonderful persons and companies that are creating this content. So we are not providing everything ourselves, but companies that are really focusing on reading books, narrated books that are really for focusing to make them enjoyable and simple for older adults.
So are narrated books popular? Like, do you find that people respond well to that?
Yes, they do, and that is just for two reasons, right? Sometimes it's just your eyes are tired. You may have a little bit of uh, macular degeneration, or you're not able to read that well, even though we have a very large screen. It's a 15 inches screen. But then just listening the narration is enjoyable. And then can pause the recording and read it by themselves, or then and then continue with the narration. So yeah, I think they do enjoy the narration. And I think someone was asking a question, and I'm sorry we didn't
Oh,
get.
I'm sorry.
it's all right, Paula. This is really fascinating. A couple of questions or more clarifications.
Yes,
So
please.
you were mentioning it's more about, you were not focused on technology, but on the person or the person's well-being. It kind of made me think that you're probably looking at outcomes, how the person, how the person would respond, how would, say, a specific, uh, for example, you talked about the touch screens, right? Whether it's inductive or capacitive, that's technology. But the
Mhm.
point is that what you're looking for from a care perspective, the reaction or the response the person would give. Did I get that correctly? Did I understand what?
Absolutely. Thank you so much for making that point, because really that is the driving force of the design and in the implementation of this product. We just take any technology that it will allow us to provide the best response for that person, and also for their caregivers. I mean, we take a lot of effort, and the design and the implementation of our product, that it's not a problem for the user, the older adult, but but it's not a problem for the families either. So the families do not need to become, like Kid was saying, the IT person. So this device is always on all the time, and the family members don't have to worry that what is not working right now, what I have to tell my mom to turn on and go, or if there is a software upgrade. We control everything, so we don't have these software upgrades that happen with other products, that then it reshuffle all your icons on your screen, and you don't know the next morning where I was. The app that I was using to read my email right now is hidden somewhere else because it was reshuffled. So those things don't happen in our system, right? And you are absolutely right. My main concern is how the user is going to respond and react, and how I keep the users at ease, and it's not cumbersome for anyone. So in many of my customers, my clients, we have the situation that mom is living in assisted living in Arizona, and the daughter and the son are either in New Jersey or in California. So we have the issue of long distance caregivers. So they are not the ones that are going to be able to take the plane and go and fix my device. These have to be self healing. So we have taken a lot of care on trying to eliminate as much as possible all the situations that may be problematic, and then the device is running for years, and then the
Again,
family
you
can
bring
interact with them.
many interesting perspectives from how technology is impacting lives. So I would like to touch on a few of potentially engineering trade-offs you would have worked with. For example, you mentioned a few keywords, kind of like self-healing and when connectivity is lost. So having worked in telecom and signal processing, I know that's a tough thing to do. So any kind of anything that you can share about some of the tough calls you had to make from the trade-offs perspectives, what were the gotchas when you were engineering the device, considering that your perspective or your goal is more from a care perspective rather than the technology perspective. So what were the
Yes.
gotchas? What were the trade-offs? Anything that you can share?
Thank you. So one of the things is how much information and how many features we add to the screen, right? Because I at all possible, I eliminate the scroll capabilities or something. So how do we make that if we present enough information on the screen, but then it eliminates those difficult gestures like scrolling or something that is going to confuse the older adult. So that is one trade-off. I mean, we don't have an infinite number of icons that we can show on the screen. Like many people just keep scrolling and scrolling, seeing all the pictures. So one of the compromises is that our by default this device become a picture frame, if you wish. So always the older adult is going to be seeing the pictures scrolling that the family sent. But then the compromise is that you have a maximum of 128 pictures. We don't lose anyone, but then if it arrives to 129, then the oldest disappear, because we don't want that just the pictures keep scrolling, and then it becomes it just no ending to
This
identify.
reminds me of what's been people have been talking about with Netflix recently. They've been talking about how you spend an hour and 15 minutes scrolling through all the stuff, and then you're tired by the time you pick the thing you want to watch. And so being able to infinitely customize this interface for people as their needs change over time is a really great way to an elegant way to handle that situation, you know?
So other thing that we took into account is the multi-party video calls, right? So we cannot have this scrolling of multiple pictures, and the pictures are getting smaller and smaller. So we limit it to have a maximum of 4 person in a video call that you can see at any time, because again,
Interesting.
we don't want that the person get overwhelmed, and we don't want that it's too small, that is going to be confusing for them, and we don't have these pictures that coming in and out, because that will cause confusion and agitation. So those are the type of compromises in the design that we have incorporated.
Yeah,
That's really
that's another fascinating thing. So where you mentioned a specific number 4 that you are restricting it to 4 family members.
Mhm.
That's kind of extremely precise. How did you come to that number? Is it a usability issue, a security issue, a data, like for example, data loss, or something else?
No, it was just a matter of from the design, from the screen, what was the minimum size that it will be adequate for the older adult to see.
Ah,
Yeah, those
interesting.
are all very, very well-known measurements for vision systems for people as they, so you always know, how robust a person's vision will be at a certain age, pretty much, right? I mean, you can really.
And then other considerations. So basically, the contrast of the design, the icons. Always the people asking to be bigger, and then the audio. Hearing loss is so pervasive in the older population. So our speakers are extremely loud. You have the volume control, but that was something that we had to adjust and improve with the multiple generation of our product. So hearing loss was a big consideration for us too. Even when people have hearing aids, not always they're using them properly, or for some reason, batteries, you name it.
They have to charge it, they have to find it. It's
Hearing loss is a big
annoying.
issue, so they have to be very loud.
We have to solve this problem. We have to, like, there has to be a better solution for hearing loss than those hearing aids. They're not. I mean, that maybe, the old days they had the copper horn you put up near your ear. They should have a real life digital version of that you can pick it up, that looks like maybe a magnifying glass or something, have as little, or a lorgnette, how people would pick up the lorgnette. Maybe there's something that you could have nearby that's a digital, like, amplifier of some kind, that just for, before you're going to bed, or you've taken your teeth out already, whatever it is. Your teeth are in a glass, your ears are in the drawer or recharging, and you have to hear something. And I think there's a role for a handy
There's
thing.
an opportunity, but also I'm also a very, very concerned, especially as the people get older, of changing habits, but also of wearing things.
Right.
They are not very good with the pendant. That is something for security that they use. And even if you have cognitive impairment, something foreign is going to be very difficult for them to use. But I think there is opportunity on enhancement, just analyzing the acoustic. I think if we reduce noise, it's going to be a big win. So if we, in an environment, if we just are able to amplify and have sort of microphone and speakers that are adapting what is important for the older adult person to listen to, and basically just reduce multiple voices and just the speaker voice loud enough. With Simpson in the space that we can do, that it doesn't mean that the person needs to use something physically. Probably that can be a big way.
So I want to show a slide while we're talking, because we're working. Everyone knows here that we work on standards too, and Paula is involved with the standards. So many years ago. So in the old days, we used to have a drawer, at Bell Labs. When the management changes and everybody's into different politics, or what they're funding or what they want to do, you have to hide your old project and pull out the other project. So we put this one in the drawer a while ago. And we were doing different things, DE, but accessibility, this kind of thing. But now I think technology is caught up. And when you have a problem with hearing, sometimes the problem is just the background noise in the movie or the TV show or whatever, even on a Zoom call or some other thing you're watching, YouTube, whatever it is. And now audio ducking is available on Apple phones, believe it or not, which is great because then you can take the background and lower the volume and raise the volume of the voice. So for people who have some kind of hearing loss, you can turn up that voice and turn down the background noise and maybe make the content more accessible to people. But it would be really cool to be able to do that even on Zoom calls and on other, other things that you're experiencing that you have control of everything, the whole channel, you have control of the whole channel. But I think it would be, it's just the right time, I think, to have a standard like this because people consume content in all new ways now. It's not just Sony selling their licensed content and not wanting to give access to that basic, all the different tracks, the background track and the voice track. They don't want to then sell you that. They want to control what their product is like when it gets distributed to the TV, the satellite, the movies, whatever it is. But now there's so much content, all kinds of content. It may be time to look at these signal processing.
And I think it will be wonderful because hearing loss is not just it affects so much the person. Hearing loss is not just that you're not listening; it just affects your cognition. It affects your personality, how you feel about yourself. So depression, anxiety, and even dementia can be a consequence of hearing loss. So being able to address that early enough and sustain it for a long time, we can add years of quality of life, years of quality of life to an individual, which are precious. So I'm all for creating a standard that would allow and enable persons to enhance their quality of life for a longer time.
So another thing we had talked about years ago that maybe it's a good time to look at it again is doing word spotting. Like you were talking about, certain words are hard to understand, right? And so you do the word spotting. Here I have an example on this picture of like you're watching TV or whatever movie with your family, and suddenly this thing you thought was family friendly has some words in it that you really don't want your children hearing, But on the other hand, there are other reasons why you want to spot a word that's difficult to understand or is articulated differently, maybe with an accent or something, and you want to take that word out and replace it with a word that's easier to understand or a word that's articulated with an accent that's more general, from the region, even if you have a regional accent, like the Swiss words. We like to hear our Swiss words, right? We could put those in, right?
But the good thing of this, and we have been talking a lot about this, Kit, is making content that is linguistically and culturally appropriate. So if you have the capability to spot some words, you can spot the whole sentence and make it at the level that someone can understand. And this is so important with medical information. That's why in our product, we're very focused on providing education that is at the simplest level and also in the right amount so person can understand the medical information.
Exactly. Now, this is an extreme example, right? So large language models are not going to help you here, right? But they really aren't going to help you with your medication instructions either. So being able to provide an interface for the family members or for people who have to, so that they don't resort to guesswork about following the doctor's instructions or what the patients have to do. And so this is the bigger picture. Paula, you're focusing on aging as an issue, but well-being and healthcare and all of that, especially the past few years since the pandemic began, many people, we did a project, Paula and I and Tom and some others. We did, what was it called again? Medical device literacy, right?
Right. Medical device literacy, yes.
Can you explain a little bit about that? Do you remember?
So we had the concept, right? And please let me know if I'm talking about the right one. But yes, thank you. The speech level of the source can be adjusted to the professional audio. So basically what we wanted to do is to have instructions of how to use different medical devices based on the literally and literacy and cultural of the person that will use it. And then we just will have sort of a database based with the unique identifier associated. Is that the project that you're talking about?
Yeah.
right?
So being biomedical engineers, when the pandemic began, we went to our native voice, which is if we have to care for ourselves and our family in the home. Do people know how to do that? Do they even know how to take blood pressure? Do they understand what it means? And so we got a grant from Tri Engineering and site, and Tom and Paula and I and Margaret and some other people worked with local schools, and we were surprised to find out the different languages spoken in that one class, that one grade level. There were like 69 people who responded to the survey, and there were 39 houses that were multilingual. And out of those, 19 languages, or some like 18 or 17, very high number of languages spoken. So we got this great idea that we got one of the students who is working with the local ambulance corps to create a scenario about how to take a blood pressure. She made a TikTok movie about how to do it. And then we gave that TikTok movie to the students in the class and their families who spoke different languages, and they recorded versions of that movie in different languages. So we wound up with a whole collection of instructional videos about how to take the blood pressure properly. And they were in a number of languages. And the ones we couldn't get locally, we reached out to our friends globally, people at IEEE in different parts of the world. And we got some really wonderful items out of that. Did you enjoy that, Paula?
Yes, absolutely. I mean, and it was, thank you for reminding me that. And then we were setting up we wanted to set up the system where you will be able to recall the explanation in your language based on your need. But the user interface, I remember we were looking at having a QR code that you, with your phone, just are going to scan it and get the language, the version that you want. But the students were very creative because they were understanding how to get the blood pressure measurement and explaining it in their own words. So it wasn't just the literary translation, it was the explanation how someone would understand the concept and do it right. Yeah, no.
And some of the things that you do also involve multilingual content, right? So you spend a lot of your time doing interpretation and translation, not just translation that you could do with Google Docs.
That is also very, very interesting, right? Because when you try to use software, and I must say the automatic translation that are out there are getting better and better. Many years ago, I was pulling my head about how Google was translating Spanish, but now they are doing a very decent job. But still, at some point, you need the speaker, because and just I'm going to give you one example. One word that we use is caregivers, but we don't have that one word in Spanish. So so you have to use sometimes a description in order to translate one word in one language to another. And Robert, I know you're agreeing with us. Probably in Chinese and Japanese are the same thing. And some, I mean, we're not talking that English is the most efficient in terms of using the shortest word. Sometimes there are other languages that are better in synthesizing a concept. And sometimes you just have one concept in one language that you cannot represent one-to-one in another. And it just,
Or
you
you
have to
have
feel
like
in,
especially in a medical context, you have a different level of,
And then in medicals, you have yet
yeah.
another
I mean,
level.
even the word embarazado, right? I mean, this is a word that we don't have in our world in English, right? It's not a thing. But it might be important in Spanish culture.
Yeah.
In Germany, in Switzerland, the Schwanger, this is a, right? And this is these words that have a very specific cultural context.
They
And
are very specific, yes.
yeah. So it's not just about translating to word for word.
No,
something
it's not. It's not. You have to understand the concept and what and how the reader is going to respond to what you are translating. Yeah, absolutely.
So Tom was at that project. Tom, do you have a couple of words you can share about your experience with that school project and the medical devices and so forth?
Well, I think you guys covered it. I mean, I thought it was really interesting, all the different languages. I mean, obviously we had a lot of Spanish and English, but there are a lot of other obscure languages as well. And yeah, I thought the students really, they did a great job with that project. They seemed, well, at least the ones that interacted seemed to be pretty highly motivated to do so. So it was an interesting project.
Yes, and then we went out to the what was that group called, the Rotary Club, and we taught adults how to, and there were adults, everyone there, they were unaware of how to take their own blood pressure. We brought out these blood pressure cups, and the students helped the adults to take their blood pressure. And one of the people there was having a problem, and we sent him to the doctor, and he had a real health need, and he needed to get
Oh, that
treatment.
was great. That was great.
Yeah, it was, I was, all the disclaimers. We're not doctors, not that kind of, we're kind of, but I would suggest you go see your doctor. And thankfully he did, so that's always an interesting thing when you, accidentally find that someone is in need of help and just didn't recognize their symptoms, So,
Yeah, absolutely. Great. Absolutely.
so what does the future hold for you, Paula? What are you looking forward to now?
Oh, well, definitely to grow the company, to reach as many people as we can, because we are really committed to this mission of helping older adults and their families, caregivers. I mean, our tagline, and we really believe in that, is changing the way the world ages. And we really think that we can achieve that by um, demystifying and embracing aging and involving them and bringing them. I mean, it's so beautiful in other communities, and it's proven that older adults live longer if they're engaged in their communities, they are respected by their communities, they are cared by their communities. So that's what we want to do, and our way to help in that process is just to simplify technology, that we can achieve this the situation of the reality of our times, that family are distributed, and we need to help ourselves with technology.
Yeah, I mean, like many of us had to, we drilled down and focused only on, like, I guess business to business applications when we were younger, and back in, 20 years ago, 30 years ago, that's really where the industries, where our profession was, and people who tried to think about these things, about how people's lives could be changed, transformed in these ways by technology. This is a liberating experience for us, I think, as engineers. And I'm really grateful that IEEE has that tagline, advancing technology for humanity. And maybe it's, eventually people go, oh, that's what they mean. Oh, that's,
Yeah.
like, because there's so many different meanings in different phases of your life, but you seem like, Paul, you seem like you've reached that where you're able to do it every single day, that your job, your life, your orientation is about advancing technology for people, for humanity. And
Yes,
it must
yes,
feel, it must feel good.
I'm blessed that I have that opportunity, and it's true, and it's true. That's what we do. That's the focus of our company, and that's what we want to do. I mean, I'm not getting younger, and I think having a purpose is very rewarding, and that's yeah, I mean, it's important for me and for my colleagues. I'm very blessed that my colleagues at the company are as passionate as I am with this purpose.
Well,
And
thank you
also
so
the people that I interact with. I mean, Kid is a force, and Tom and every one of our friends at IEEE, all of them. And I can see the face from Robert, which is wonderful. I think also he's passionate about making good.
And you remember, oh, we worked with Florence, right? Remember Florence
Yes,
and the book and the tours and all that? I mean, we've done a lot of very cool things in the past few years.
we
And
have done a lot, of
very,
course.
and a lot
Yes,
of it facilitated by IEEE and you know, and it's nice that like you may have a job, people telling you what to do at the daytime and all that, but when you're having your spare time to be able to use your skills, your voice as an engineer to do things that you choose to do, it's very uplifting. So, and thank you for letting us collaborate with you, allowing us to collaborate with you on these things.
thank you.
Okay, so thank you very much for your time. Anybody else have any questions of Paula? No? Okay. I just want to say thank you so much for joining us
Thank you.
today, and these recordings will be available. Thank you.